So our first presentation today is Christian Nichols from Hanover College, and he will be talking to us about gender differences in attributions toward drug users. Take it away, Christian.
Thank you, Steve. So for the big picture, we'll talk about what we're talking about today. So first off, the big picture is attributions of drug users. So I'm going to go into three different topics within that being general attributions of drug users, differences in attitudes towards gender of the user, and differences in attitudes by gender of the attributor. Then we'll go into my hypothesis, my participants' procedure analysis, my results, and then my discussion. So first off, the general attributions of drug users. Palmer, JJ in 2013 found that nurses were slower to treat drug users in medical situations due to their attributions. And Kenny Hendricks et al. In 2016 found that primary care physicians had negative attributions toward drug users, but also believed that treatment could help. Secondly, the differences in attitudes towards gender of drug user. Hangman, Anglin, and Farabee in 2001 found that while comparing prison conditions, that women prisoners were given more access to drug reform programs than male prisoners. In 2012, Sorgel, Stein, and Myers found that interviewees were more likely to help women but suggested coercion treatment for men. So thirdly, we went to differences in attitudes by gender of attributor. So again, Palmer 2013 found that females were at lower odds for saying that drug addiction is a choice, while Nguyen in 2008 found that observational studies people are in the way, found the studies of men were more ethical in the professional business setting. So my research question was, how do men and women differ on attributions toward drug users? And my hypothesis is, overall, the participants will be more critical of a condition where the drug user is a male. I also hypothesized that male participants will be more critical than female participants overall. So for my participants, I had 85 people between the ages of 18 and 69. Gender breakdown was 33 males and 52 females. These were all recruited from the psychology research on the net, Mass Emails, and Snowball Recruitment. So participants for the procedure would first follow a link to an online survey. The first page they would encounter would be the procedure description. Secondly, they would get a background paragraph of a male or female drug user. And this is an example of one of these. I'll go ahead and read it to you. Sorry. Dave is a 32-year-old man who lives in a small town in middle America. He lives in a modest house with his wife and mother. Dave had a full-time job at the local factory in town, but he was laid off 3 months ago and he was not found work since. Dave has been using drugs for the past couple of years and has recently came to the realization that he needs to quit using. Dave uses both marijuana and heroin, but he realizes that both of these are negatively affecting his life. He would like to commit himself to a rehabilitation center so he can work on his addiction and hopefully eliminate addiction from his life. So thirdly, they would be asked a hypothetical question of how much they would donate. And this question stated, in a hypothetical situation where you had $100 to donate to a charitable cause, how would you divide the money between the person's rehabilitation and the drug education in local schools? So they would answer that question, and then they would go on to the survey, which is derived from the GBAI-R. It's a criminal attribution scale. Cronbach's alpha for that I had was 0.888. The answers were a 5-point Likert scale from strongly disagree to strongly agree. A couple examples of these items would be, this person should feel ashamed for their drug use, or this person is entirely to blame for drug use. After all of this, they would be debriefed. So for my analysis, I wanted to do two-way ANOVAs because I had two independent variables of gender of addict and the gender of participant, but I also had two dependent variables being the attribution scale and the participant's level of donation. So for my ANOVA results, I won't read everything to you, but as for the level of donation, there was no significant interaction. But for the attribution scale, as you can see here, the gender participant was marginally significant or bordering significance, if you will, with a 0.07 instead of 0.05. So continuing on with the analysis, as for the gender participant and the attribution scale, you can see here that males have scored higher on the attribution scale, which means they are more critical than females, and this was bordering on statistical significance. So again, gender of the drug user was not significant, at least there were no significant findings, but the gender participant, there was marginal significance. And the implications of that maybe would be if you're a drug user and you're seeking some kind of professional help, and maybe your healthcare providers are all male, you might be at a slight disadvantage or have reason to worry just because you may not get the care that you need because of these attributions. So going to the limitations of future research of my study. Limitations, the online survey may have made people more generous when donating. I feel maybe an in-person survey may have cause for more honest answers. Also, the attribution scale was derived from a criminal attribution scale, which may have been leading in the questions. It may have been leading to a more negative attribution. For future research, other variables may have been important, these being profession, age, socioeconomic status, anything other than just gender. I think there may have been something there that could have contributed to the study. Any questions?
Why do you think that there's a difference between the genders? Why do you think that there's like the females are like more viewed as it's not as like they won't get like so coerced or whatever? Why do you think that there's like that big of a difference?
I wasn't really sure about how big of a difference there would be, but I kind of noticed that at least in my life, men have been more critical, and then with the readings that I'd found, they also shared the same feelings that I had. So I just wanted to see how different it was, and in this situation, it was almost significantly different.
I'm just curious, what made you choose gender rather than, like you said, socioeconomic status or a different variable?
I just felt like gender would be, well, technically easier. I felt like you could see a more spread just by gender than having to go into the weeds of job title or socioeconomic status.
What do you think your results would have been based on a different like socioeconomic status? Do you think that would have been similar to what you found?
I feel like it may have been similar, but the difference may have been actually more significant. I'm not really sure though.
Any other questions? We still have a few minutes.